This video covers foods and drinks to avoid or limit in pregnancy, as certain foods might make you ill or harm your baby. Let's start with caffeine. Caffeine is found in tea, coffee, herbal teas, energy drinks, cola and chocolate. You can have some caffeine but aim to limit your intake. Consuming too much can increase the risk of complications. The good news is that you can still drink 3 cups of tea, or 2 mugs of instant coffee, or 1 mug of filter coffee a day. You could ask for a single shot coffee in a coffee shop or choose decaffeinated versions. What about alcohol? UK guidelines recommend that the safest option is to avoid alcohol. Alcohol can increase the risk of miscarriage, or your baby could develop fetal alcohol spectrum disorder. Can you eat eggs? You can eat raw, partially cooked and fully cooked hen eggs as long as they have the red British Lion egg stamp. You can eat products made from these eggs like mayonnaise, coleslaw or mousses. Eggs without the stamp should not be eaten raw or partially cooked. Certain cheese and dairy products can contain bacteria that can make you or your baby unwell. It's safe to consume pasteurised milk and dairy products, so hard cheeses like cheddar and parmesan are safe to eat, as are pasteurised soft cheeses like mozzarella or cream cheese. Avoid soft mould-ripened cheeses like brie, camembert and some goat's cheese, and avoid blue vein cheeses like Roquefort and Danish Blue. It's advisable to avoid soft-serve ice creams as they may contain unpasteurised dairy and eggs, but ice cream sold in tubs and on sticks should be safe to eat. Are there any meats you need to avoid? You can eat meat such as chicken, pork and beef as long as they're well cooked with no trace of pink or blood, and cold pre-packed meats such as ham and corned beef. Avoid cold cured meats unless thoroughly cooked. Avoid raw and undercooked meats. Avoid liver and liver products like pate, and game meats like pheasant. Most fish are fine to eat. You can eat cooked white fish, sushi as long as the fish is cooked thoroughly, cooked shellfish such as mussels, lobster and prawns, and you can eat some oily fish but limit to no more than 2 portions per week. Tuna contains more mercury than some other fish, so it's a good idea not to eat too much. Avoid swordfish, marlin and shark as they're also high in mercury. Updated advice from the Food Standards Agency recommends pregnant women avoid cold smoked or cured fish as it may cause a serious form of food poisoning. And you should also avoid raw shellfish. Advice on peanuts has recently changed. Peanuts or peanut butter can be eaten during pregnancy as part of a healthy balanced diet, unless you're allergic to them or your health professional advises you not to. Practicing good food hygiene reduces the risk of food poisoning, which can be more serious when you're pregnant. Always wash hands after handling raw meat and wash soil from fruit, vegetables and salad. Ensure food is heated thoroughly and piping hot, especially takeaways and ready meals. Store chilled food in the fridge at the correct temperature, and food should not be eaten after the use-by date. For more information, visit the NHS website or speak to your midwife or healthcare provider. Make sure to watch the other videos in our pregnancy series and subscribe to our channel.